Hello everyone, it's Rafael Gutierrez. Welcome to our channel. Today I'm going to talk about pain and pain compliance and what it is. Now, here's the funny part. If you actually are dealing with pain, a lot of pain is really up in your mind. And what I mean by that is this. The nerves in your brain, the nerves from your body actually go into your mind and they can determine what pain is. But just because your hand hurts doesn't mean that the damage that you're getting is in the hand. But before I go into that, I am going to tell you about what I'm going to be doing on the first Saturday of February, which is I'm going to be doing another live presentation. This time it's going to be of the bones and ligaments of the hand and why we use the hand a certain way in martial arts. Now, I will tell you there was an article I read once upon a time which said that the hand was made to be used as a fist. Really, it wasn't. As a weapon, the hand is really not that good. We really need to learn how to use it properly. If not, you end up getting a lot of fractures, which we'll talk about then. But going back to pain, what pain really is it's the messages that your body gives your brain telling you that something is wrong. Now, I don't care if the pain is abdominal pain, knee pain, headaches. What you're actually getting is a message telling you something's wrong. You need to stop that. And there's different types of pain. There's actually something called referred pain. Referred pain is something hurts, but it's not there that the damage is taking place. It's somewhere else. There's actually a lot of different things. Pain can be sharp, dull, achy, a lot of different things. But for the most part, I'm going to talk about pain in general. Now, first thing I would tell you about pain is this. Listen to your body and deal with people who understand that they have to listen to your body. What I mean by that is this. If something hurts, you really shouldn't be doing it. Reason is, again, remember, pain is your body's way of telling you something's off. Now, there are certain things that you may have to do. There's a big difference between discomfort and pain. And that's something that each individual has to determine that. And a lot of pain we can't really see. For instance, if you think about it, there are some things that end up happening where obviously there's pain. For instance, someone breaks a bone. Obviously, they're in pain. But there are other pains that you can't see because the damage is actually internal. Let's take a herniated disc. Now, a lot of people end up having herniated discs, and some of them don't have any problems with this. And I eventually will talk about herniated discs. But if you do have a herniated disc, certain moves can cause the pain to get worse. And some moves will actually cause the disc to actually herniate more. It can end up causing major compression of the spinal cord. And so it's important, it's vital that if something hurts, that you talk about it and that people listen to you. Now, sometimes you have people who tell you, well, this is the way where it's done. If it hurts, well, tough. This is the way you have to do it. You really have to be careful there because remember, the damage that ends up happening to your body because you're doing something that is bad for your body can end up causing problems for a lifetime afterwards. Anyone who has herniated discs can tell you about how they may have been feeling it, or hip problems. A lot of times people do techniques that destroys their hips and they feel it, and they can actually, some of these people, once their hips are destroyed, they can tell you, well, I realize now that it started when I started doing this technique here and I continued to practice it and the pain got worse and worse. Well, if the pain's getting worse, stop. There's a reason why it's hurting. You're doing damage to a lot of different internal organs. Now, pain is actually a weird thing because it's not, all of us, anyone who's in martial arts knows that not everyone feels the same amount of pain. There are some people who a slight movement will end up causing a lot of pain. And some people you almost, let's say you're doing some sort of wrist lock. Some people you get them just a little bit and they're in excruciating pain. Some of them you can almost twist the arm off until they still won't feel the pain. Well, the idea is, yes, everyone has different threshold of pain, and also the body has different thresholds for how much you can bend. So one of the big things I'm actually trying to tell you is listen to your pain. Now, how bad can pain be? And the truth is there's different ratings. For instance, if you have a small pain, you may not even think about taking anything. You may think, okay, I'm going to stop doing this for a little bit until it gets better, and then start again. That may not be a bad thing, especially if it's not horrible pain. The other thing that can sometimes happen is sometimes you'll have pain that's a bit stronger where you actually need pain relief. Now, a lot of time right now, there's a huge movement on, people shouldn't get pain relief. Now, the truth is you have to listen to your body. There's a reason why you may need pain relief. And sometimes the pain relief is needed so you can actually evaluate what's causing your pain to begin with. And again, there's different types of medications that people can use for pain. We do have some stuff like over-the-counter non-steroidal anti-inflammatories. These are your aspirins, your acetaminophen, which I don't like for many reasons. And it can go up to injections and prescription strength and even opioids. And those are actually some ways to deal with pain temporarily. These really shouldn't be used forever. These should actually be used until we can actually find a reason, what's causing your pain, and try to find out how we can make it better. Now, again, if it's a movement, don't do that movement. You can actually, a lot of times people talk about, oh, we can't modify it. The truth is, if you look at martial arts, you see a lot of modification of techniques. You see a lot of modifications of kata. There's actually some katas where where some people can't do them just because of past injuries and how long they've been doing it. Does that mean that this person just, shouldn't do karate? The answer I would give is no. We actually have to modify it for you. If we're teaching, we actually are producing a product for people. And I know people don't like to think about that, but if we're teaching, we want the best for our students, and that karate we teach has to be fitted for them. And if someone is in pain doing something, we need to pull back. It's not, I know a lot of people talk about, oh, there was an old once a great sensei who used to grab their students and yank them to get them to the right level. Well, if you do that, you're going to end up having damage. If not, then later on in life. It's actually the reason why if you do study injuries and you look at either competitive athletes, especially if they're competitive early on in their life, dancers, gymnasts, you end up seeing that as they get older, these injuries do come back to haunt them. So I guess the big takeaway, make a short video, right, is this. Pain is your body's way of telling you that something's wrong. If something's hurting, if a technique hurts you, if a stance hurts you, you have to learn to modify it for who you are and make it better for yourself. A good instructor will be able to show you how to modify it. And sometimes it's as simple as moving the knee from one place to another. Sometimes it's strengthening the muscles that are around areas. I hope you enjoy this video and have a nice day. And join me for the presentation on the hand in the first weekend of February. Well, have a nice day.